Hey, this is very fun. I'm at the Greater New York Dental Meeting, and I ran into Terri, who's a hygienist. I live in Phoenix. She's right next door in Mesa, Arizona. You were at my office a couple weeks ago. You work for Millennium Dental Technologies.
I do.
Which their main product is a Indie YAG laser, which does the LANAP procedure.
Yes.
So I assume out of the thousands of watching you, but half of them have never heard of LANAP.
Correct.
Tell them what LANAP is all about.
LANAP.
And how did you get into it?
Well, I was very fortunate. I saw an ad on a job site looking for an independent rep, and I applied for it. And here I am today. I started in August of this year, so I've only been doing this for a few months.
But how long have you been a hygienist?
I've been a hygienist for 12 years.
12 years?
I was an assistant for quite a few years also, but I've been in the industry for about 22 years total. I was in the Air Force first, and they trained me on the job how to be a hygienist.
Really? So you joined the Air Force?
Yes.
And then they just said, we need a hygienist? Did they teach you themselves, or they send you to a school? Or
Well, back then in 1994, when they trained me, they didn't send us to hygiene school. They trained us on the job.
was it was the Air Force?
Air Force.
So what base were you at?
I was at Aviano Air Base in Italy and Clovis, New Mexico, Cannon Air Force Base.
And they trained you in Italy?
They trained me in Italy, yes. They trained me how to...
and their training made you a licensed, registered dental hygienist?
No, only could do it for the United States Air Force, and then I got out of the Air Force after my 4 years of duty, and I went to hygiene school at NWTC, Northeast Wisconsin Technical College.
Wisconsin.
I'm originally from Green Bay.
And you went up there because you were Brett Favre's girlfriend?
No.
Or is this Aaron Rodgers' time?
This is Aaron Rodgers' time.
Oh, okay. So you're up there during
No,
Aaron
actually,
Rodgers?
it was Brett Favre time.
Okay, so I'm not completely crazy.
You're not off. No. Actually, originally, I have a lot of ties to Green Bay. My grandpa was a Packer, so he was an offensive lineman for the Green Bay Packers.
Are you serious?
I am, and his cousin was Curly Lambeau.
No way.
My claim to fame.
Are you? So why are you in Mesa, Arizona when you'd be a celebrity in Green Bay?
Well, we decided back then, many, many years ago, to, let the city own our team. So I don't think I'd actually be much of a celebrity there.
So before we get back to dentistry, I just got to ask you one Green Bay question that everybody wants to know. When are they going to put a roof over that stadium?
Never.
Why is that?
There's something about going to a Green Bay Packer game in the winter time when it's cold and snowing that they just love about it.
So what I heard, they're all drunk. They're all
drinking
whiskey.
You would think you have to be to handle that weather.
They have to all be. Now I know the story. They're all in there under a blanket drinking whiskey.
Pretty much.
Pretty much. Okay. So then you did hygiene for 12 years?
I have been a hygienist now for 12 years.
And then you decided that you just wanted to move out of chair side and do something different, or what were you thinking?
I knew that I've been in this industry for so long. I have just this passion for dentistry. I always would love to have gone to dental school, but, I'm 41 right now. I'm like, I don't think I could handle going to dental school, the cost of dental school. So I said, okay, what else can I do? I don't want to leave this field. So when I found this opportunity to work with Millennium Dental Technologies,
Millennium,
was ecstatic.
who's the man and wife by that? I can see his wife, a blonde-haired woman. Who's the man? He's a periodontist?
No, he is a general dentist, Dr.
What's his
Robert
name?
Gregg.
Dr. Robert Gregg. Where do they live?
I believe they live near Cerritos, California.
Okay, and his wife, the blonde lady, is she a dentist too?
She is.
Or is she a periodontist?
She's a general dentist.
Okay, so it's two general dentists, and they've owned this thing for 10, 20 years?
Actually, originally it was a different general dentist than him that started it, and now then Don Gregg decided, hey, I'm going to try this out, and became a LANAPer also. And then over time, they ended up getting married. So now they are a unit.
Tell both of them. My son Ryan is doing the podcast. Ryan can do, most of them are done by Skype. So they could Skype me. They could each be at two separate locations, or if they're married, they could be one. But I would love to podcast interview them.
I would love it.
Because the reason I came and drug you to my booth is because LANAP is a huge buzzword. I'm always getting a lot of questions from it. So basically tell them, explain to the homies, what is LANAP? Where does the name come from? What does it mean?
Well, LANAP it's pretty much it's laser-assisted surgery without the cut and sew. We can go, and we are the only FDA cleared laser to more or less treat moderate to severe periodontal disease. With our protocol, we have a specific LANAP protocol that we use, and our doctors use it, and that is what helps with patients. The protocol is what takes care of it. So they learn and are trained how to handle and what exactly to do to take care of their patients.
And when we were little, all periodontal disease around teeth. And now that we're in our 40s and 50s, now there's periodontal disease around implants. There's peri-implantitis. Is this technology used around peri-implantitis? Is this something that can be used around?
Absolutely.
Absolutely.
It's called LAPIP. The perio. Yep. We have LANAP and LAPIP.
Okay, so you have LANAP and LAPIP.
Right here and right there. Yep.
So LANAP is laser assisted laser assisted
new attachment.
Okay, protocol.
Yes. It's a laser assisted new attached. Of course, this is when I'm going to do that, right?
Laser assisted new attachment protocol?
No, that is the protocol.
And then LAPIP is laser assisted peri-implantitis protocol? Is the P okay. Because I got to tell you something. When you're looking at these implant success rates, what they're doing is they're cherry picking the data. They always take a person that lost all their teeth from Streptococcus mutans.
Yes.
And then they place the implants in the most dense bone, anterior mandible. They never show you the research from patients who lost all their implants from P. gingivalis,
right?
Where P. gingivalis ate all the teeth and then placed those implants up in the maxilla soft bone. It's always, I lost them from strep in the hard bone. Because if you have gum disease and you lose teeth from gum disease and you put titanium in a mouth with gum disease, you're probably going to have issues with peri-implantitis.
Absolutely.
So how do you, so continue. I didn't mean to interrupt you.
Oh, no worries. Actually, I remembered my word. It's laser assisted new attached procedure protocol.
Procedure.
Yes.
Okay.
And so what our laser does is it specifically gears to attack bacteria, diseased tissue. Anything that has, if there's a tissue area that has disease in it, our laser is going to get down there and get rid of that.
And that's because the laser is attached, the Nd:YAG is attached to the red color, and the disease is going to be inflamed.
So that's why our laser is so successful with taking care of these patients, with putting and having such dramatic changes with bone level, and even, let's face it, there's bone attachment. There's new bone coming back up. So with all these different dentists that are using it, general dentists, periodontists, they're all seeing fascinating results. A lot of doctors were even getting oral surgeons on board. I had a lady stop by yesterday actually, who's an endodontist, and she was excited over it because an endodontist understands when you take that bacteria out of a situation, that bone fills back up. You have a big abscess, and you take that infection away, that bone comes back. It makes sense. And so for her, it was really easy to understand. And actually, ironically, her husband's a general dentist. So she was just really blown away by what our laser could potentially do for her patients.
And whenever we do a podcast, it's downloaded on iTunes from every country on iTunes. So my international viewers are probably wondering, is this chick Canadian? And the answer is, Green Bay is right on the border of Canada.
Right, I'm pretty
your next
close.
question, you're probably asking, did she star in Fargo? And it's like, no, but that movie was filmed in North Dakota. So she's kind of Canadian, Fargo-ish, because they're wondering, she can't be American. You sound so Canadian. But
I do, awesome.
So then tell them about peri-implantitis, because I think a lot of hygienists and a lot of dentists one's like, not to be dumb, but how do you clean around an implant?
Exactly.
Like, some people are afraid to scale them. Some people want to buy plastic instruments. Some going to say, I bought the plastic instruments, but it's not really doing anything. Hygienists say, can you ultrasonic scale that? Then some going to say, well, that'll roughen the implant. Then other people say, well, a lot of implants intentionally roughing the hell out of the surface area to get more bone. So talk about the LAPIP.
All right. So with LAPIP, and you're right, as a hygienist, there's nothing more intimidating than when you see your patient come walk through that door and you look at their x-rays and you say, oh, no, they have implants, especially when you don't have implants or instruments to clean them with. So one practice that I'm at, they specifically bought titanium scalers. So they said, okay, we're comfortable with you using titanium scalers. So if you
So the
can use
scalers are made out of titanium, or the scalers are made for titanium?
made out of titanium.
Made out of titanium.
Yep. So they
Titanium
have
on
a new instrument so that we can actually use that. Millennium does not have incorporate that. That's just something that I found over time. And with that, we're actually able to get underneath the gum tissue and actually clean things. But with the plastic instruments, you ended up leaving so much. You ended up leaving stuff behind. It starts to break down underneath, and so that's why so many implants I thought were failing for a while, because of the plastic instruments we were using. At least that was my opinion, or my belief on it was these plastic instruments aren't doing anything, and at the same time they're you're not cleaning much with them because there's no strength to when you're scaling. There's nothing that you're removing with a plastic instrument. At least I couldn't, personally. I mean, maybe there's other hygienists that feel different, but that's how I had always felt about it. So with our LAPIP protocol, we treat it where you lower the settings as if you were going to do LANAP, but you lower your settings, and there's a specific setting that doctors are trained to use. So when you use that setting to treat around peri-implantitis, the implant is going to, now you're not going to touch the laser to the implant, because it's metal. So you're going to go around, excuse me, you're going to go around the tissue there, around that implant. So you go around it, and they had a live showing of this, viewing of this yesterday. And it was amazing because you could see him going around and just making this tissue much healthier. So he's getting all that bacteria out of there. And I thought, wait, he's using that piezo and going underneath and using a piezo around it. But he's not going strictly onto that implant. He's going around it, making sure things are cleaned up. Then, of course, he went ahead and, you do your second pass. And there's a specific protocol that you have to follow. That's what LANAP is all about, and that's what LAPIP is all about, is a protocol that you follow. It's a perfect recipe. It's like a cookie recipe. You don't want to change your recipe if you already have the perfect ingredient, right?
So let's get specific. This is Dentistry Uncensored with Howard Farran, and the reason it's uncensored, we ask all the brutally rude and uncomfortable questions. What does this cost?
Well,
how do they buy this? What does it cost?
Well, I look at it this way. When a doctor says, that's the first question I get asked quite often. And I like to stop and say, how much do you as a doctor charge for osseous surgery per quadrant? How much are you charging your patients to have this procedure done? If you were to do traditional osseous cut and sew, how much would that be per quadrant? And what would you say?
You mean when you flap back
Yes.
the deal and do a quadrant?
Yes, because that's exactly, realistically, LANAP is that. It's surgery.
And is that what people bill for? Is that the insurance code they bill for?
Well, as a rep, I'm not really required to state that specifically. They do train them in training during their training program as to what exactly to code. But when it comes to perio surgery, most times, if you're going anywhere between $1,000 to $1,500 per quadrant for osseous surgery, you're going anywhere from $4,000 to $6,500 for a whole mouth, and this is a whole mouth procedure. It's not just a couple spots here, a couple spots there. If you want to do that, you can't call it LANAP. You call it assisted with a laser. It's some type of way to get the infection down, but you don't want to call it LANAP unless you're using it for the whole mouth. So that's why we go that route. So if you look at it where it would be, we'll go the lower number, $4,000 for one mouth. Half the patient, so to speak, half the mouth would cover the cost of what the laser would be for every month.
That it's a lease?
We do have a lease option.
But is that the lease you mean?
Yes, we do.
And so what's the amount and how many years and what's the lease payment?
Well, there's several. We do have a finance person that talks specifically about that. The way I understand it is normally, depending upon how much the doctor pays, for the laser, sometimes if it's a doctor that's getting brand new into it, he's going to pay for the training and he's going to pay for the laser. Now, usually, when it's not in the middle of a big dental show, it's about $109,995. So,
$109,995. So $110,000.
Just under $110,000. So when it comes to a convention such as something as big as the Greater New York and the end of the year, of course, we do like to try and offer a cash consideration for our doctors, or product consideration, something to help get a doctor motivated to do this, because we want to see more patients get this opportunity.
You know Tom?
I do. I met his wife at lunch
Come
the
here,
other
Tom.
day. It
Come
was
say
fantastic.
Hi. Do you know she lives in Mesa?
She does.
Come here. You got to get in a podcast, Tommy. I want you to be in a podcast. This is my best friend from Creighton Dental School. He's practiced up the street for me for 20 years. Tom, man, you are my idol and role model in so many ways. So, Tom, are you using LANAP? You're investigating it? Yeah. Yeah, I saw her one time. So the 110,000, is that usually a 5-year lease, 6-year lease, 7-year lease?
It can be up to, I want to say, because of course I don't have that in front of me.
But just more.
Yeah, 4-year, 5-year, probably even as much as up to 6 or 7. I wouldn't be surprised. Yeah. But it's a very low interest rate, 1.99%. That's why we can get it to a point where if a doctor looks at it like, okay, half the mouth that I do is going to be covered.
Can I give you, so the founder of this name, where's it been? It's Bob Gregg?
Robert Gregg.
Robert Gregg. Mm-hmm. And what's his wife's name?
Dawn.
Dawn,
Dr.
D-A-W-N?
Yes.
Gregg.
Mm-hmm.
What's her name, Gregg? And they're in Cerritos?
Cerritos area, Cerritos, California.
Yeah, you know what I always thought was weird? So if they buy this for 110, what would you guess? 75s for the laser, 25 for the training, or
yeah,
would you say?
It's about normally if it's at the 110, it's about 30,000 for the training and about 80,000 for the laser.
Okay, 30,000 for the training, and I'm only saying this not because I want to be a jerk or rude or whatever,
no worries.
but I believe success is related to how many uncomfortable questions you have. And I've heard
Exactly.
so many people. I know a lot of my friends. Okay, so in the 30 years I've been a dentist, periodontal, especially a periodontics, changed the most.
Yes.
I mean, you look at the quadrants of perio surgery that were done in the 80s, and they've gone down in the 90s, because a lot of them, people are just pulling them and placing implants.
Right.
Kind of like in endodontics, apicoectomies has been plummeting. I mean, you do a root canal, it looks great, you didn't miss any canals, it's failing. Most people say, why do an apicoectomy? I'm just going to pull it and go straight titanium. But this company is the most different in the sense that the training is all bought after you buy the laser. And so many townies have asked me, well, why don't they put a course on Dental Town, or why don't you explain the training without having to buy the machine? And this company, you have to really buy an 80,000 laser before you get the training. And I always thought, and maybe I could be completely wrong, and this is not my business, whatever, but it just seems like if Robert and Dawn would get on Dental Town, where we put up 350 courses, they've been viewed over 500,000 times. If those two guys would get up and give a 1-hour course on this, it would get rid of all the mystery stuff.
Yes.
I think it would bring a lot more qualified leads. I bet if they put that online CE course on dentistry, maybe 1 out of every 3 or 4 or 5 people that watched it would want to buy LANAP.
Exactly.
But and also you see that when you search for when you search on Dental Town for LANAP, that we just did.
Yes.
I mean, there's pages and pages and pages and pages of threads on LANAP, and I always think that one of the reasons there's so much LANAP because these guys don't give any training until you buy the machine.
Right.
So tell them that. Tell them that they come on, Robert and Don come on, and we'll do a 3-way, all 3 of us on the podcast, and I'll just answer them like, why can't I get trained on this before I buy the laser? Why do I have to buy an $80,000 laser before you train me?
But the main thing is, and you got to realize, not every laser is created the same. Not every laser does what we want it to do. Not any laser can do what our laser can do. So if you train a doctor to do LANAP, and they think, oh, I'm just going to use the laser I already have, my diode, you're going to have one angry patient And that's the key. We have to protect our doctors that put money towards this training, because if we don't protect those doctors, it just puts it out there where Millennium doesn't care.
Well,
and that's
the one
why.
thing I have to tell you in my backyard, and Tom will verify, is that 25 years ago, when these things were coming out, none of the periodontists were using it. And now over the years, now I see a lot of my periodontists that I refer to are now absolutely adopting this and using it. So it's definitely gone from a bleeding edge technology to a leading edge technology.
Absolutely.
It's definitely. And you say there's periodontists that you know in Mesa?
Oh, yes. Yeah. Well, realistically, with our company, we, 2 general dentists found this, but now, and only mostly the general dentists were jumping on board. Now we have about 50-50 periodontists doing this and 50% general dentists.
Who's our periodontist in our backyard? You're in Mesa, I'm in Phoenix. Who's the periodontist that lectures on it in our backyard?
That would be Dr. Alan Honigman.
Alan Honigman.
Yes.
Yeah, we need to get him on a podcast.
Absolutely. He is
in
fantastic.
Fact, you two should come by my house.
Okay.
Because Ryan and I film these at our dining room. And so you and Alan, when you get back home, you and Alan come by the house and you sit down and we'll do an hour.
That would be fantastic.
You, me, and Alan.
That would be fantastic. I would love that.
Sound like a plan?
I think that would be great.
And should we bring Tommy?
Oh, sure. Absolutely. Because the funniest thing was I was going to say to you, hey, I met Dr. Mattern and his wife Sharon. I would really, really like to invite all of you guys out for dinner so that we can all discuss this.
Well, we should do that. We'll do the dinner and we should do it at my house.
Absolutely.
So the deal is Tom and I went to Creighton. We both got out of school.
Amazing.
We both opened up down the street for each other. We both had 4 kids. So every Friday, I would dump my 4 kids off at his house and have Friday night off.
Nice.
And every Saturday,
All
him
right.
and Sharon would dump their 4 at my house. So for 10 years, we all got off one night a week by
Fantastic.
dumping all of our friends off for a dental patient.
Right.
And whenever you had a crazy psycho patient, I'd always say, "Oh, you need to go see Tom Mattern. He's right up the street. He's a lot better than me." And
I love it. That's fantastic.
all right, so get Alan Hoggeman.
I will do
Alan
that.
Hoggeman, who I've paid several times to speak at the Townie meeting. I think he's an amazing periodontist, and I know he's big into lasers. He's big into high tech. He's a big educator.
Excellent.
And go pick him up. Come by my house, and we'll do an hour with the 3 of us.
Excellent. And one thing I did want to mention is also with our laser, with using the LANAP and LAPIP protocol with the Periolace MVP7, what ends up happening is we actually allow the body to heal itself. We actually allow the body to do what it's supposed to do, and that's why we have so much success. We're giving the body the perfect situation, the perfect environment, making that environment perfect so that these results that you see, that you'll see all over, that people think, oh, that's got to be Photoshop. You can't Photoshop x-rays, at least not to my knowledge, when you're looking at an x-ray. So that is the beauty of what our laser truly does, is it allows the body to heal itself naturally.
And before you go, Tommy, does Tom know your Lambo connection?
No, I don't think he knows my
Is there
connection.
parting words? Do you know her connection to the Green Bay Packers? Tell him your connection.
My grandpa was, I did tell you this, okay, so Green Bay Packer, his name is, my great-grandpa is actually who it is. Latour is the last name, and he's cousins with Curly Lambeau. So it's pretty exciting.
And if you buy a LANAP, you get season tickets front row center to the Green Bay Packers. I heard it. That's what you said. You heard it here on the Howard Speaks podcast.
You actually said that, so that's really nice of you.
All right, so very good. Well, I'll see you in Phoenix.
Thank you
All
very
right,
much.
bye-bye.
Go Packers.